Hi everyone, welcome back to my YouTube channel. Today we are going to talk about sarcoma. And here at the side you can see the diagrammatic representation of types of sarcoma for the reference. So let's start our topic with introduction. Sarcoma is rare but serious form of cancer that arises from connective tissue in the body such as bones, muscles, fat, blood vessels, nerves and cartilage. Unlike carcinomas, where begin at epithelial cells, sarcoma originate in mesenchymal cells and can occur anywhere in the body. As we already told that the cancers are of two types, carcinoma and sarcomas. Carcinoma originates from epithelial tissue type and while the sarcoma originates from the mesenchymal tissue type. Due to its diverse origins and often late diagnosis, sarcoma requires specialized understanding for early detection and treatment. Definition: sarcoma is a malignant tumor that develops from the connective or supportive tissue of the body. These tissues include bones, muscles, fat, cartilage, nerves, and blood vessels. Sarcomas are classified as either soft tissue sarcoma or bone sarcoma, depending on the type of tissue origin. They are aggressive cancers that have the potential or invade nearby tissues and metastasize to distant organs. Types of sarcoma. Sarcomas are broadly categorized into two main types. First is soft tissue sarcomas and the other is the bone sarcomas. First, soft tissue sarcomas. They originate in soft tissue such as fat, muscles, blood vessels, and connective tissue. Common subtypes of soft tissue sarcomas include liposarcoma that arises in fat tissue, leiomyosarcoma that develops in smooth muscle tissue, angiosarcoma that is formed in blood or lymph vessels, rhabdomyosarcoma that originates in skeletal muscles, and synovial sarcoma that is found near joints and tendons. While the other type of sarcomas is bone sarcomas. They begin in the bone and are less common than the soft tissue sarcomas. Their main subtypes include osteosarcoma, that most common type in children and adolescents, and the other type is Ewing sarcoma that occurs in bone or surrounding soft tissue, mostly in youth. And the third type is chondrosarcoma that arises from cartilage cells and is more common in adults. Now let's talk about causes and risk factors of sarcomas. While the exact cause of sarcomas are not fully understood, several risk factors have been identified. First is genetic mutation and inherited syndrome. Like Leigh-Fermin syndrome and neurofibromatosis is the examples of genetic mutation and inherited syndrome. Next is previous radiation therapies. Individuals that are exposed to a high dose of radiation may develop sarcomas years later. Third cause and risk factor is exposure to certain chemicals such as herbicides, dioxins, and vinyl chloride are the cause of for the sarcomas. Next is chronic swelling and lymphedema that can predispose to lymph-induced sarcoma. Next is injuries on implants. Rare cases of sarcoma have been reported near foreign bodies. In many cases, however, sarcomas occur without any non-risk, but these are the most common causes and risk factors for sarcomas. Symptoms of sarcomas. Symptoms of sarcoma vary based on the tumor size, location, and type. Common signs include a painless lump or swelling is there that is often the first noticeable symptom. Second, there is pain or discomfort that is especially as the tumor grows and press on nerves or muscles. Then there is maybe limited mobility if the sarcoma is near the joint. There may be unexplained fracture in case of bone sarcoma. There may be fatigue, fever, or weight loss, and they may occur in advanced stages of sarcoma. Because early symptoms are subtle or absent, sarcomas often go undetected until they reach a considerable size. Diagnosis of sarcoma. Diagnosing sarcoma involves several steps to accurately identify the type, stage, and spread of disease. First is by medical history and physical examination. Second, we can do to imaging study for diagnosis like X-rays, MRIs, CT scan, or PET scan to assess tumor size and location. Third, we can do is a biopsy, that is, a sample of tumor is taken and examined under a microscope to confirm malignancy. Fourth, we can do blood tests to evaluate overall health and rule out other conditions. Fifth, we can do molecular and genetic testing that help in identifying specific sarcoma subtypes and guides treatment. Accurate diagnosis is essential due to the wide variety of sarcomas type, each requiring a tailored treatment approach. Staging and grading of sarcoma. Sarcoma are staged based on their size, depth, involvement of nearby lymph nodes, and presence of distant metastasis. Grading involves assessing how abnormal the cancer cells look like under a microscope and how quickly they are likely to grow and spread. A higher grade indicates a more aggressive cancer. Treatment of sarcomas. The treatment for sarcoma depends on the type, location, stage, and overall health of the patient. Common treatment modalities include surgery, that is, surgical removal of the tumor with the margins of healthy tissue in the primary treatment. Limb sparing surgeries are common, although amputation may be necessary in several cases. Second, we can do is radiation therapy, as radiation may be given before surgery to shrink the tumor or after to kill remaining cancer cells. So it is mostly used in combination with the surgery. It is also used in inoperable cases where surgery has high risk than the sarcoma itself. Further, we can do is chemotherapy that is more commonly used for certain subtypes like even sarcoma and rhabdomyosarcoma. It can be administered before or after surgery and may be used to treat metastasis. Next, we can do is targeted therapy, that is, drug designed to target specific genetic mutation in cancer cells are used in some sarcomas. These therapies tend to have fewer side effects than traditional chemotherapy. Next type of treatment is we can do is immunotherapy. That is still under study for sarcomas. Immunotherapy works by helping the body's immune system recognize and attack cancer cells. It is a multidisciplinary approach is often needed to ensure the most effective treatment plan for sarcoma. So most of the treatment modalities are used in combination with each other. Prognosis of sarcoma. Prognosis of sarcoma depends on multiple factors like type and grade of sarcoma, tumor size and location, stage at which the sarcoma is diagnosed, completeness of surgical removal, and patient age and overall health. All of these affect the prognosis, and generally, early stage sarcomas that are completely removed have a favorable outcome. However, high-grade or metastatic sarcomas are more challenging to treat and have lower survival rates. Prevention of sarcomas. There is no guaranteed way to prevent sarcoma, but certain steps may reduce the risk. First, by avoiding exposure to non-carcinogens. Second, by limiting unnecessary radiation exposure can prevent sarcoma. Third, by genetic counseling for individuals with a family history of cancer. Fourth, by regular medical checkup if at high risk. Early detection remains critical for improving treatment modalities, especially for sarcoma. Conclusion of this lecture video. Sarcoma is complex and rare cancer that requires awareness, early diagnosis, and specialized treatment. Though it affects a small percentage of cancer patients, its aggressive nature and potential to affect individuals of all ages make it critical areas of oncology. Advances in medical imaging, molecular diagnostic, and treatment strategies continue to improve the management and prognosis of sarcoma. Continued research and public awareness are essential in fight against this challenging disease. And this was all about sarcoma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.